What up guys, it's Kitty Cats MD. I recently came back from visiting the Ross University campus in Barbados, and I gave a presentation to the first semester medical students, giving them some general tips on how to succeed in med school. And they brought up some really great questions about how I ended up choosing internal medicine and ultimately cardiology with the hopes of elucidating how to figure out what specialty to go into. So I wanted to make a quick video and explain some general tips about how to choose your specialty. So how did I come to choose internal medicine? Well, the short answer is that I hated everything else. That's gonna be all for today, guys. Don't forget to like, follow, share. This is your boy Kitty Cats MD signing off. I'm just messing with you guys. Kind of. The reality of the situation is that I really didn't enjoy most of the other specialties. Peds, didn't really want to deal with kids that much. Psych, I just didn't really enjoy dealing with that patient population. OB-GYN, gross. Surgery, I thought was kind of interesting, but I think it was really just the cardiology aspects of it that drew me to it. And then the only other specialties I really had to, cross off were family medicine and emergency medicine. So when I first went to med school, I thought that I actually wanted to go into family medicine. But what actually made me choose internal medicine was that I would get the same or similar enough continuity of care with my patients, and that I'd be able to practice in an outpatient primary care setting. But internal medicine also gave me the opportunity to potentially apply to a lot of subspecialties and fellowships. On the other side of the spectrum is emergency medicine, where it's fast-paced, there are a lot of procedures. It was the first time in med school when I learned how to place IVs that I felt like I was actually doing something with my hands, placing IVs, drawing blood, putting on casts, and it was really fun. But again, it lacks that continuity. All right, so I'm done talking about myself for now. But what should you take from this? There are two really important things, and one is that you have to experience the specialty firsthand. The second part is a little bit harder, and that's figuring out why you went into medicine in the first place. Do you want to do a lot of procedures? Do you not want to do any procedures? Do you want to be inpatient, outpatient, a little bit of both? What do you see in your career in the next 15 years? You're going to be doing this job for the next 20, 30, 40 years, hopefully. So it's important that you first figure out inside what you want in your life in medicine, and then find that externally in a specific specialty. I had an idea in my head of what I thought these specialties were like, and then I actually got to experience them. And then the second portion of that is that you have to see, can you do this for the rest of your life? Just like with emergency medicine, I thought placing IVs and central lines and intubating people might be really cool, but I don't really want to do that for the rest of my life. You have to try to see what the life of an attending physician is like. It's hard sometimes in med school to separate the life of a resident, which always sucks, and the life of an attending. Attending physicians work in a lot of different practice settings, and there's a lot of different options depending on if you go into a university setting, a private setting. And I really encourage you that if you think you know what specialty you want to go into, try to experience it in different settings, or at least in different hospitals, so you can see the variations in how people practice it. Now, the last thing that I want to bring up is buyer's remorse. I've met tons of people who have asked me, I'm really interested in surgery, but what if I don't like it that much? What if what I do as a med student isn't quite what it's like in residency and as an attending, and I hate it, and I'm gonna be stuck doing it for the rest of my life? If you end up matching into a residency and you realize you hate that specialty, you can always reapply. I met tons of people in the real world who were surgeons for a year or two, hated it, went to internal medicine, and now are cardiologists. People who went from family medicine into internal medicine. Just because you make this decision in residency, which is a really big deal, but it doesn't mean that you're stuck doing that for the rest of your life if at some point you realize that it's not for you. Sure, it's gonna mean reapplying to the match all over again, doing that residency application interview process all over again. But if that means going through a short period of time of uncertainty and a little bit of pain to end up practicing in a specialty that you actually enjoy for 20, 30, 40 years, it's worth it. So I hope this video helped you guys understand my thought process on how I chose internal medicine and cardiology, and helps you out a little bit. Selfless plug, don't forget to subscribe. If there's a specific question that you have that you want me to make a YouTube video about or just want to respond to, throw it down in the comments below. You can always subscribe to my blog and follow me on Instagram.